Today we are going to talk about Parelaphostrongylus tenuis, also called Meningeal worm or brainworm. This parasite is usually a quiet infection in white-tailed deer, but it can be devastating when it ends up in the wrong host. White-tailed deer are the normal definitive host. Adult worms live around the meninges near the brain and spinal cord, and deer often show little to no disease. Larvae eventually pass through the lungs, get coughed up, swallowed, and leave the body in feces. Snails and slugs pick up those larvae in the environment. Then an accidental host, like an alpaca, llama, goat, sheep, elk, or other susceptible ruminant, becomes infected by eating an infected snail or slug while grazing. The pathogenesis is the important part. In deer, the worm completes its life cycle fairly normally. In aberrant hosts, the larvae migrate out of the gut and wander along nerves toward the spinal cord and brain. As they move through nervous tissue, they cause inflammation, swelling, bleeding, and direct mechanical damage. Because the worm migrates unevenly, the neurologic signs are often asymmetric, meaning one side may be worse than the other. Clinically, early cases may show subtle hind limb weakness, stumbling, dragging toes, knuckling, ataxia, or a stiff, strange gait. As damage progresses, animals may develop paresis, paralysis, circling, head tilt, blindness-like behavior, neck pain, abnormal mentation, recumbency, or death. Camelids are classic high-concern animals because spinal cord injury can become permanent. Diagnosis before death is usually presumptive. You put together the species, season, neurologic signs, deer exposure, wet pasture, wooded areas, and snail or slug habitat. Fecal testing is usually not helpful in abnormal hosts because they typically do not shed larvae like deer. CSF may show inflammation, sometimes with eosinophils, but it is not perfect. Definitive diagnosis is usually at necropsy by finding the worm, or compatible brain and spinal cord lesions. Treatment should start early when the disease is suspected. The goal is to kill migrating larvae, reduce inflammation, and support the animal while the nervous system recovers. Veterinarians may use fenbendazole or ivermectin protocols, plus anti-inflammatories such as dexamethasone, flunixin, or meloxicam depending on the case. Nursing care is huge: deep bedding, help rising, easy access to food and water, preventing pressure sores, and physical support for weak animals. Prevention is easier than treatment. Reduce deer access to pastures and feed, avoid wet or marshy grazing areas when risk is high, limit snail and slug habitat, fence wooded edges if possible, and work with a veterinarian on prevention plans. Key takeaway: